Hello, I decided to do more research on Turner syndrome. It only affects females because they don't have the Y chromosome. The X chromosome is usually inherited from the mother. The female that is usually affected by Turner syndrome are usually sterile but have gonadal streaks instead of ovaries. Turner syndrome is a sex chromosome aneuploidies, and it only affects 1 in 2,500 newborn females, unlike the other ones that affect more. So it's more rare than the other ones. The symptoms and signs, usually the women are shorter. They have webbing. In about half the cases, there's webbing of the neck, widely spaced nipples, and edema in the feet on newborns, and they have sparse body hair. They usually don't do a diagnostic test unless the doctor notices some of the symptoms, because it's super rare, so it's not something that's tested often. The same test is used for every age, which is called the karyotype, which is a blood test that shows you an image of your chromosomes. The prognosis for someone with Turner syndrome is similar to a normal life. They sometimes live a shorter life if they're faced with multiple chronic illnesses and their illnesses aren't being addressed. But if their illnesses are being addressed and they're being taken care of, then they have close to a normal life expectancy. Some chronic illnesses that they might be faced with is hypertension and obesity. The treatments, there's a wide range of treatments because there's so many different mental and medical issues that are associated with it. Depending on the problems they're experiencing, the doctor will issue the treatments based on what chronic diseases or illnesses that they are dealing with. Some of the most common treatments for females with Turner syndrome are growth hormone and estrogen therapy. With growth hormone, they use it to increase their height as much as possible, since people with Turner syndrome have problems with their growth and they're shorter. So they use it at appropriate times when they're growing. And estrogen therapy is also used, and they use it to help them begin puberty. So they usually use that around 11 or 12.